Gentlemen, there's a private habit many older men repeat for years without a second thought. It feels harmless, it feels natural, it feels like something you've always done the same way. But over time, this habit quietly damages blood flow, not just to your penis, but to your prostate, your pelvic nerves, and the entire lower body circulation system that supports firmness, sensitivity, and confidence. And the most dangerous part? No pain, no warning sign, no sudden failure. Just a slow decline that most men blame on age. I'm Dr. Thomas Carter. For over 3 decades, I've worked with men in their 60s and 70s who thought something inside them had worn out. In reality, their bodies weren't broken. They were responding to years of the same private behavior done in a way that restricted blood flow instead of supporting it. Tonight, I want to explain what that habit is, why it weakens blood flow over time, and how to correct it so your body can recover instead of decline. Section 1. Why blood flow matters more than age. Let's start with something every man needs to hear. Firmness is not about strength. It's not about willpower. It's not even about testosterone alone. It's about circulation. Your erection depends on blood entering faster than it leaves. Your prostate health depends on steady circulation. Your nerve sensitivity depends on oxygen-rich blood reaching delicate tissue. After 60, your blood vessels naturally become a little stiffer. That means anything that restricts circulation, even slightly, has a much bigger impact than it did when you were younger. This is where the private habit comes in. Section 2. The habit that slowly restricts blood flow. The habit is repeated stimulation done in a compressed or tense state. This includes sitting hunched forward, clenching the pelvic floor, holding your breath, using excessive pressure, rushing through the experience, engaging without relaxation. Each of these creates one common problem. They compress blood vessels in the pelvis. Blood can't move freely through compressed tissue, and when blood flow is repeatedly restricted, the body adapts by reducing sensitivity and limiting response. This is not aging, this is conditioning. Let me explain what happens biologically. When you stimulate yourself while tense or compressed, arteries narrow instead of opening. Veins drain blood too quickly. Nitric oxide release is reduced. Pelvic muscles tighten instead of relax. Nerves receive less oxygen. At first, the effect is small. You may not notice anything. But over months and years, this pattern trains your body to associate stimulation with restriction instead of expansion. Eventually, blood flow weakens even during arousal. That's when men say, "My firmness isn't what it used to be. I don't feel as sensitive. It takes longer to respond. Morning wood disappeared." The body learned the wrong pattern. Section 4. Why older men are more vulnerable. In your 20s and 30s, your body could tolerate mistakes. Your vessels were elastic. Your nerves were resilient. Your recovery was fast. After 60, vessels are stiffer, recovery is slower, nerves are more delicate. Circulation needs support, not stress. That's why habits that once seemed harmless now have consequences. It's not punishment, it's physiology. Section 5. The most common blood flow mistakes. Here are the patterns I see most often. 1. Sitting while compressed, especially on hard surfaces or hunched forward. 2. Gripping too tightly. Excess pressure collapses small blood vessels. 3. Rushing. Triggers stress hormones that constrict arteries. 4. Holding your breath. Reduces oxygen delivery instantly. 5. Ignoring pelvic relaxation. A tight pelvic floor blocks circulation at the base. Each one alone weakens blood flow slightly. Combined, they quietly drain your vitality. At this point, many men realize something important. They're not failing, they've been unknowingly working against their own circulation. If this is helping you connect the dots about your own body, it's good to stay close to information like this. Many men never hear these explanations, and it changes everything once they do. Now let's talk about how to fix it. Section 6. How to restore blood flow naturally. The solution is not force, it's not intensity, it's not more stimulation, it's relaxation and positioning. Here is the correction I teach older men. Step 1. Open the pelvis. Choose positions where your hips are relaxed and blood can move freely. Lying down or standing works best. Step 2. Soften the pelvic floor. Before stimulation, take one slow breath and consciously relax the muscles between your sit bones. Step 3. Reduce pressure. Gentler contact allows vessels to stay open. Step 4. Slow everything down. Slow stimulation keeps nitric oxide high and stress hormones low. Step 5. Breathe continuously. Never hold your breath. Steady breathing equals steady blood flow. These changes alone often restore circulation within weeks. Section 7. What men notice when blood flow improves. The first improvements are subtle. Warmth returns. Sensitivity increases. Erections feel fuller. Firmness lasts longer, and morning wood appears more often. Then confidence follows. Not because you forced anything, but because blood is finally moving the way it's supposed to. Section 8. Why this works better than medication alone. Medication can help open blood vessels temporarily, but if your habits keep compressing them, results stay limited. When you correct the pattern, medication works better, and many men find they need less or none at all. You can't fight restriction with chemistry alone. You have to remove the restriction. Section 9. A reminder every older man needs. You are not broken. Your body is not betraying you. Your circulation is responding exactly as it's been trained to respond. Change the pattern and the body adapts again. Blood flow is dynamic. It responds to how you treat it. Section 10. Closing words. If tonight's message gave you a clearer understanding of what's been happening quietly over the years, take that as good news. Awareness is the first step toward recovery. Be gentler. Breathe. Open the pelvis. Let blood do its job. Your vitality doesn't disappear with age. It changes its requirements. I'm Dr. Thomas Carter. Take care of yourself and keep choosing a stronger tomorrow.